Medial border, inferior medial border of the medial malleolus to the inferior border of the navicular. Whatever is the distance depending on the foot size. A big foot, or maybe this big. Whatever, you're gonna open that area, okay? Then, second incision will be at the distal 1/3 of the tibia. You palpate the medial border of the tibia, a centimeter, and you're gonna make a 4 centimeter incision at that level. At the same level on the anterior compartment from the tibial crest 1.5, same size. Okay. Here you want to inferiorly retract the tibialis posterior, exposing the medial border of the tibia. Here you want to lateralize the tibialis anterior, exposing the lateral aspect of the tibia. And then here, whatever you want to go and target this. If you have the biotino DC screws, they work great. But in osteopenic bone, an interferential screw is the way to go. This is what you use for ACL reconstruction. It has a big bite. Have you ever seen those? Google them. A biotino DC screw from Arthrex, that is the most common use, and an interferential screw for ACL. It looks like a big hunk. When you make a hole, slightly, you make the hole bigger than the diameter of the tendon, of course, because you have to go inside. So they always have like a measuring. You measure that, you know, and then if it's 6, you put 7. Okay? Why? Because you have to put the tendon plus you have to put the interferential screw. So now you have two things occupying the same hole. Makes sense, okay? Then, what is the suture stage that you start here and start bringing it down? You do that one. Yeah. Or a boneo, either one. Either boneo or crack out. Okay? Why? Because you want to pull, have a good pull on the tendon. Put the foot at maximum dorsiflexion. You're gonna pass all these systems. They have a kid needle, or you go right through the bottom of the foot. You pull really hard, and while someone's pulling the tendon and holding the foot, you're putting your interferential screw on that hole. Okay? If it's an arthritic joint, if it's does it really matter? No. You just want to be sure that you grab as much bone as possible. Okay? If you grab one of the adjacent joints, it's not a problem. That makes sense? Okay. For the tibialis anterior tendon transfer. Well, if you dorsiflex the foot and create valgus, I'm gonna feel it right there. So plantar flex and valgus. Feel it right there. So you want to feel the tibialis anterior, put it under tension, don't do this. Plantar flexion. If you dorsiflex, you plantar flex. If you create varus, you're gonna go valgus. Remember that in everything. Go the opposite. You're gonna do a fracture reduction, do the opposite of the generation force. Now you feel, and you just take the mark. Hold the foot there. And these limbs are terrible. This is FYI, November 19, we have 10 limbs coming. Nice. Hey, by the way, we need to have the devices there. It's gonna be the alumni.
Okay, which day did you say?
November 19. We have 10 limbs that are like really, really good. So you can see right there, okay? So we're gonna make our incision, not at the level of the ankle, sorry. We're gonna go at the same level of the navicular, but up. That's how I always remember. Right here in this area, okay? So let's do it. So we're gonna make our first incision. And you can see that it's obvious that it's there. Okay. So you open the sheath. And you have, go like this. These tendon transfers are easy, very easy, and they can, you have the tibialis anterior. See how everything's about incision. You don't want to go this way, you just want to go slightly at the other side, okay? You never want to make an incision right over the tendon. Everything heals better if the incisions are not done right over a little bit medial, a little bit lateral, but not smack center, because the tension of the tendon and the motion may just create the adhesions of the common sense, isn't it? Sometimes we don't use it. So go like that, open up here, okay? We open a little bit more this way, okay? And you're gonna dissect it and transfer, but let's do the split, okay? Now, same dissection, 1.5 centimeters, 1.5 from the tibial crest, 5 centimeters above the ankle. What we identify that is, let me take this one out so it's not out. So that's your tibialis, okay? So what you're gonna do now, make a little tiny hole right in the center. So you can have an idea that this portion right here is gonna stay, the other portion here is what is gonna go laterally.
Do you use umbilical tape there?
You can do umbilical tape, you can use circular wire, which
Tape's good.
yeah, anything. I think that anything will be good. Okay, so then let's do the same one that we have here, okay? So we're gonna go very simple. We know that this is the lateral side, so we're gonna feed these two like that. Go like this, okay? You're gonna make a little knot here. Okay, and my recommendation is, let me see if I can, if it will cut. And you guys may struggle a little bit, but that's probably like. Now, you're gonna go underneath the sheath. You see that right there? Open it up more so you don't struggle. It's not a crime. And you can just kind of like free things up a little bit. It will be better, okay? Grab it. You guys see that? Open it. And then when you pull that, it will split it. Now, when it's split, you cut the lateral side of it, or the more dorsolateral, keep the medial attachment, you pull it up here, and now you put it right here. Okay, go ahead. You guys continue.